Replacement of 4 veneers for our colleague. New BG Dental case special for you on our YouTube channel. Let's go! Hello dear friends, dear colleagues. We are back with our BG Dental cases, and this time we are happy to present you a very interesting clinical case dedicated or regarding veneer replacement for our colleague. And the case that has interesting history, interesting story behind it. Let's say, you know that we provide a lot of dental courses for our colleagues, hands-on, virtual courses, online, so on and so on and so on. And sometimes we have our colleagues as a patients. They trust us, and we are very happy that our colleagues trust their teeth to be treated in our clinic. So from time to time we have our colleagues to be treated as the patients because they know our level after the courses and so on and so on. And this patient is very special. She was not participating in our course, but she was referred to us by her colleague who attended our course. He said, if you want to do aesthetic improvement for your smile, you have to go to Ukraine, to Kiev, to Dr. Maxim, and he will be doing your veneers and smile. This colleague is from Romania, by the way. And yeah, so there is the initial situation. We have a very prominent discrepancy between aspect ratio, centrals and laterals. You see the different levels of the cervical areas. The shape was not aesthetic. The color, black triangles, and many things that our colleague wanted to replace and to improve in that particular case. Also, we have non-proper fitting of veneers. You can see exposed margins on the cervical areas everywhere. So basically, the replacement of these veneers is driven by biological perspective and also by aesthetic perspective as well. So you can see now initial situation, and we are going to replace them, to remove them. And there are many methods to replace veneers, and one of the methods is to use erbium laser or water laser. In a very quick and efficient way, water laser removes veneers from patient's teeth. Another option is classic. You just take a burr and you drill these veneers out, and that technique requests a lot of attention to be accurate in order not to hit or not to damage two structures. So you have to be very patient during the procedure, and you have to work with magnification. In this case, I decided to try the new burrs, actually the burrs that are designed to drill zirconia crowns out. I decided to use this burr for ceramic cutting, and I can say it is pretty, let's say, efficient. This burr is from Comet if you want. So I started to use my electric motor and increasing handpiece, drilling out veneers with a high speed mode. The speed was about 200,000 RPM. And you see once ceramic becomes thin, you can see exposed two structures through. So in that case, we decrease our speed for 60,000 RPM. With that speed mode, you can be really efficient and accurate, removing veneers. And then I changed the burr to the red one. You see now the red diamond burr inserted into the electric handpiece. And I can drill my margins, I can relocate my margins slightly down to improve aesthetics there, and you can see that there is no bleeding on the gum. So here you can see straight after veneers removal a picture, and according to our design, according to our aesthetic preference, aesthetic perspective, we still need to improve cervical areas on lateral incisors. We made some measurements with a periodontal probe in order to understand the biological width, and here we decided to go for gingivectomy, and I used electrosurgery. Here you can see video. This video was shared many times in our Instagram account, and there were a lot of questions from colleagues from all over the world what type of electrosurgery is this, what is the counter name, and so on and so on. I replied, but now also I would share information about this device. Exactly, this one is integrated in my dental unit. This is Sirona Zero Tone, the name of the device, Zero Tone. So the electric cutter by Sirona integrated in my dental chair. So with a very thin electrode, it works very accurate. I removed exact amount of the soft tissues, and see now immediately I took red diamond burr, low speed, 50 or 60,000 RPM. I relocated my finish line. Actually, I moved my finish line down, improving this way aesthetics, and you can see the gum is not bleeding because even now I'm touching the gum with a red burr. The reason why it doesn't bleed is that we use electric motor again, low speed, red diamond burr, a lot of water coolant, so the gingiva will be like, you know, under massage session in comparison with a turbine. So here is a final step of preparation. I took my red burr again, low speed, we put retraction cords, we improve our finish lines. Now you can see some steps working dry. The speed is 10,000 RPM only with air cooling from assistant side, and gentle movements, no pressure. So in this case, there is no risk of overheating. Even though these teeth are not non-vital, all these teeth are were devitalized with endodontic treatments. So even though we don't want to overheat dentin in non-vital cases as well. So you have to follow these rules that I mentioned before. So again, the rules are: this video is about benefits that you will have from our online workshop. Presence effect. This is a unique feature by Belograd Academy that literally moves you to our training center and you can stay close to speaker. This is like over-shoulder format. The training process is filmed through the video system from the microscope, and there are two more cameras broadcasting close-up and general view. This way, you can see everything in precise details. Efficiency. Do you agree, guys, that over-shoulder workshop with detailed video and explanation is way better than regular slides? The third benefit is convenience. So basically, you don't need to go anywhere, and you can study in comfort conditions, in your home, in your office, during running exercises, from your phone, from your computer, from your tablet, and you can do anything you want with the content. So join us as we shifted online education into the next level. We work with a low speed, roughly 10,000 RPM, electric motor, increasing handpiece, red diamond burr, gentle movements, no pressure, air cooling from assistant side. So that will bring you some confidence regarding not to make pulp as barbecue. Okay, so here is the picture straight after preparation, before build-ups, replacements, and you can see the gum is very okay, considering the fact that we took some gum from lateral incisors, relocated finish lines, move them down, so you can see, so the gum is roughly okay in such a case. I can just imagine if this case was resolved with a turbine, everything will be like, you know, like a meatball around. So here is veneer for bonding, a monolithic Emax. We have our isolation. We can do isolation even in that difficult cases with the subgingival preparations. You have to find out the proper clamps, proper rubber dam, some additional isolation. Like in this case, for example, we used also Teflon tape, putting in and packing Teflon down to get a little bit more invagination of the rubber dam, to get dry field of our isolation, to bond veneers properly. If you want to know more about veneers, actually, let me just go back. I would suggest you some new information here, not new actually, but some tips. So if you want to know about isolation, veneer bonding, and actually planning, proportions, photography, preparations, provisional veneers, impressions or scans, I would like to invite you to come here to our training center in Kiev for hands-on course, we have a special program that is named Big Veneer Course, or Veneers from A to Z, and you will learn everything and you will do by your hands everything from A to Z. Planning, photography, communication, mock-ups, preparations. We do also provisionals, we do also isolation and veneer bonding. So everything will be covered and you'll be experts after that course. Here I would like to share with you some tips and tricks regarding cementation procedures. Here you can see the surface of ceramic after hydrofluoric acid etching. Sometimes you can get this chalky substrate which is salt that has to be removed, and we can remove this salt by means of different methods, like for example you can use ultrasonic bath with ethanol or distilled water just to remove the salt, or you can use phosphoric acid as I used here, just 20 seconds or 30 seconds of phosphoric acid, then you rinse it, then you dry it, and you can have a very perfect surface for silane. So you put silane and then you bond your veneers with your favorite composite cement for veneer bonding. By the way, I would like to ask you to write down in comments your favorite cement for veneer bonding. I would like to have some statistics, because I have statistics like an old statistics like 2-3 years ago. I would like to see if there is a change in the market. So please write down which cement you use for veneer bonding. I would like to see some rates, some statistics. So here is the lateral picture after veneer bonding. Here you can see also a straight picture straight after veneer bonding. Still some inflammation around soft tissues. Before and after, aesthetic improvement, proportion improvement, surface improvement, fit, and so on and so on. Here you can see from that perspective, you can see before and after smile. Patient is very happy. Me also is very happy. I'm very happy because this patient is very special. It is our colleague. She's our colleague, and trust her teeth to me. So that is very big responsibility. Lateral picture. And after 3-4 months, I got an intraoral picture from her side. She sent me this picture that you can see no inflammation, interdental papillas are okay, everything is okay, she's happy, I'm happy also, a good result, good integration, and so on and so on. So this is the case, it's done. I would like to say, if you are watching us for the first time, don't forget to sign up and to put like, okay? For the rest, I would like to say, may the dental force be with you, and see you next time on our BG dental cases, or here in our BG Academy in Kiev, Ukraine. Stay safe. Bye-bye.